This portion of New Day Northwest is sponsored by EvergreenHealth.
Welcome back to New Day. Many people experience back pain, right? Like everybody in this room, I think, right now. And according to the American Academy of Orthopedic Surgeons, roughly 8 to 11% of the population have a condition known as spinal stenosis, or what they call baby boomer back. Joining us now is neurosurgeon Dr. Shiveindra Jeyamohan with Evergreen Spine and Neurological Care. Welcome.
Thank you.
I'm going to turn this into my own personal appointment, I think. So it's called baby boomer back because this is something that happens over time, and people are now at that age where we're experiencing it?
Exactly. You know, it's interesting that the cost of back issues to the United States every year is estimated between 50 and 200 billion. That's billion with a B dollars. So it's a big problem. And spinal stenosis is a big part of that. You know, the baby boomer generation, they worked really hard. They literally carried the country on their backs, pun intended. And of course, degeneration happens over time and it causes spinal stenosis, which is kind of a narrowing of the canal where the nerves and the spinal cord really go through, usually in the cervical or lumbar, which is the upper neck or the low back.
Yeah.
Exactly.
So we have an x-ray I want you to look at. It's not mine, but tell me what this shows.
So at the very bottom, you can see that there's two vertebrae that are kind of slipped on each other. That's called a spondylolisthesis. And there's many different reasons to have spondylolisthesis. It's not uncommon to catch these on images as we get older. And then if you look down in the middle of the spine, you can see almost a tube coming all the way down. That's our spinal cord, and those are spinal nerves. And right at that area where there's a slip, there's some really tight, what we call stenosis or narrowing, and the nerves just aren't getting through.
So what do you have as symptoms if this is going on?
So someone like this will probably have something called claudication, and claudication is basically our fancy term for saying pain down the legs when we walk. When we are probably able to walk 50 feet, 100 feet, everybody's different, and then we get to a point where just our legs feel heavy, cramping, numbness, tingling. We have to sit down, kind of change positions, and then we can get up and walk a little bit more. And eventually those symptoms are just so difficult to live with that something needs to be done. And that's
now,
where surgeons
is this
come
like
in.
the shooting pains that go down your thigh or the back of your leg, or it's achiness?
It can be both. So if it's one of the kind of holes where the nerves come out, the foramen that we call them, then yeah, it's a very typical kind of what we call sciatic or shooting pain down the legs. If it's more central stenosis, like that MRI that we saw, then it can be also the cramping or the pain down both legs.
All right, so let's talk about what we can do about this.
So fortunately or unfortunately, we already kind of know, and the answer is really good living. So eating well, exercising, not smoking is a big part of it. Trying to keep the weight off of our bellies as we get older, it's tough to do.
Why does smoking make a difference?
So smoking causes a lot of inflammation in the body, and we're noticing that it really accelerates the arthritis in the back. You know, it's not uncommon that I see patients who are smokers, and you know, if I had to look at their MRI, I would have guessed they're 75 years old when really they're only 55.
Ooh. So how do you treat this then? What do we do?
There's a lot of different things we can do. So, you know, usually I try to start conservative, physical therapy, activity modification, medications can certainly help. If those
like anti-inflammatories?
Anti-inflammatory, yeah, exactly. There's also some anti-seizure and antidepressant medication that we're finding has some interesting effects on nerves and really actually helps with these kinds of symptoms.
I had never heard of that.
When that fails, though, then we start talking about surgery, and that's the kind of stuff I do. I like to do minimally invasive surgery where we make tiny incisions, go in with tubes, look down a microscope, and try to physically take off all the bony spurs and the degeneration that's really pushing on the nerves.
And then you open up the space so the nerves can do their thing without being impinged or whatever the proper word is. All right, so if you do that kind of surgery, what are the risks and what's the recovery like?
Sure. So with any surgery, there's always a risk of bleeding, infection. There's water around the nerves called CSF that can leak. Heart attack, stroke, death with any surgery. Typically, it's a pretty safe surgery, and everybody's risk profile is, of course, unique depending on how healthy or unhealthy they are. I do a lot of these surgeries on an outpatient basis, meaning if we do it at 8 a.m. in the morning, a lot of these patients are going home by afternoon, having dinner at home. Absolutely. As soon as they're ready to walk, we have them up and walking up and down stairs. Maybe not lifting a whole lot. I wouldn't recommend walking the dog or lifting your grandkids, but, basically living activities of daily living, doing the dishes, doing the laundry, all totally fine.
And it seems to be successful and long-lasting?
It's very successful. Patients usually, I can say, come back to my office very happy and glad that they had the surgery done.
Awesome. Thank you so much
Absolutely.
for talking to us about this, because I think we all get there sooner or later.
course.
For further treatment options at EvergreenHealth Spine and Neurological Care, please visit their website. And as always, you can find that on New Day's homepage, too. Coming up, getting control of anxiety and stress during the holidays. Not that that ever happens when Wellness Wednesday continues.